Hi, good afternoon. I'm Dr. Ramdip Ray, liver transplant surgeon and GI surgeon at Artemis Hospital in Gurgaon in Delhi NCR, Northern India. Hi. We are continuing with our series of talks, series of little tidbits on Facebook Live about different aspects of liver diseases. And today we'll be talking about hepatitis B. The infection, the virus, what it does in our blood, what it does in our liver, and if we are bad, if it's unlucky for us, then maybe it can cause liver cirrhosis, maybe it can rarely cause liver cancer, and sometimes in some patients we do have to do liver transplant for hepatitis B related liver diseases. Now the hepatitis B virus, it's a kind of virus which can enter our body and enter our bloodstream. So it's an infection which is transmitted from one person to another, but do not regard it as an infectious or a contagious disease, in the sense that if someone has open tuberculosis, is coughing out sputum which is infected with the tuberculosis bacterium, so that is a different kind of infectious disease where it can spread from one person to another by close contact. But that's not the case with the hepatitis B virus or the hepatitis C virus. The routes of spread are very categorical. There has to be transmission through blood or body fluids, which means if I have blood which is infected with hepatitis B and this blood is transfused, given to another person who does not have hepatitis B, and in the process if the blood is not checked, then the person can get the hepatitis B virus from me. So there was a time when blood banks did not have the necessary infrastructure to be able to check for the hepatitis B virus. In those days it was quite unfortunately common that one would get hepatitis B virus from blood transfusion, which has happened with a few of the celebrities in India, which you may be aware. So it can happen through the transfusion of blood which is infected with hepatitis B. It can happen through sharing of needles by drug addicts. Now unfortunately, although the menace of drug addiction has decreased, but in some parts of our country the menace of drug addiction is still there, and sometimes people get addicted to injectable drugs and they share needles. Now if someone has hepatitis B and another person is sharing the same needle, sharing the same syringe and injecting the drug with the same blood, can get infected with hepatitis B. Similarly, someone can have vertical transmission. Now this is something I would like to talk about. What do you mean by vertical transmission? Which means transmission of hepatitis B virus from the mother to the child. Now if unfortunately a pregnant mother has hepatitis B infection, then with regular tests nowadays one should be able to detect during pregnancy that one has the hepatitis B virus, check for the level of virus, and then take medicines, tablets, simple tablets, entecavir, tenofovir. They are such very simple, easy to take, minimal side effect drugs which are available now. So during pregnancy we advise this antivirals, and so that the level of the virus, the number of viruses in the blood decreases, thereby decreasing the chances of the baby having the virus, the infection. On top of that, once the child is born, once the baby is born, the baby is to be immunized against the hepatitis B virus. Now with a combination of the antiviral tablets with those vaccines which are now available, you can avoid the baby getting the virus around the time of childbirth. Otherwise, it is not easy to catch the hepatitis B virus from someone else. Some precautions which we can take to be really careful is like, if I have a cut, if suppose I'm working in a hospital, I may be a doctor, I may be a nurse, I may be a visitor to a hospital, and there may be someone who has hepatitis B virus, and for any reason if that person's blood comes in contact with me, and if I have a cut on my skin surface, then I can have the hepatitis B virus. So if you have a cut, if you have a wound, cover the wound before a situation like you're going to a hospital, or if there is a situation where you might get a blood spill or something like that. So we just need to be careful. Other thing we can be careful about is when you're going to the barber to get a maybe a shave, then at least ensure that it's a new blade every single time, because you don't want to be using a blade or a razor which has been used by someone else. And in general, there are some good practices of personal hygiene. Do not share razors with anyone, do not share blades with anyone, do not share toothbrushes with anyone. You never know, someone may have a gum bleed, someone may have a cut inside his mouth. However close the person is, it's always a good idea to have your own items of personal hygiene which are not shared with anyone else. So what I have been focusing about now is the mode of transmission, how the disease is transmitted from one to another, and how we can avoid getting the virus. Now, if unfortunately you do have the virus in your body, then there are simple blood tests which can pick up the fact that you have had the infection. And if you have had the infection, whether the virus is now still in your body, whether your body has successfully fought the virus and thrown it out of your body, or whether there are enough viruses in your body, in your blood, to start getting worried about. If you have done those blood tests and you get to know that you have the hepatitis B infection, then you do need to consult a gastroenterologist, liver specialist, a hepatologist, to ask the simple question, do I need to have tablets to kill the hepatitis B virus? Because these tablets are easily available, they are not very expensive, and therefore hepatitis B can be easily controlled, easily managed, treated before it causes side effects, before it causes complications in our body. It's a hepatitis virus. Hepatitis relates to the liver and inflammation of the liver, which means these viruses, they are present in the blood, but then they go and sort of home into the liver, and that's where they make it their den. They stay there and they infect the hepatocytes, and once inside the liver cells, we call them hepatocytes, one inside, they tend to stay there for a very, very long time, to the extent that sometimes they can even get into the DNA, the genetic part of the cell, the DNA of the hepatitis, the DNA of the liver cells, and so make little changes in your DNA so that there is an increased chance of developing tumors, cancers. Unfortunately, hepatitis B virus can cause liver cancers. Not very commonly, but yes, it can. Otherwise, even if it doesn't cause cancer, it can cause enough damage to the liver cells, leading to fibrosis, leading to cirrhosis or a scarred liver. So it's like a liver which ages quickly. It's like a liver which gets scarred, and scarred livers don't function well. So that leads to cirrhosis or chronic liver disease. So hepatitis B virus can just come into your body and go away after being successfully dealt with by your body's immunity. It can stay in your blood, grow, multiply in your blood, and just remain silent for years before it causes any problems. It can go on to a situation where it causes liver fibrosis, liver cirrhosis, and all the complications of liver cirrhosis, and sometimes it can even lead to liver cancer. So it's very important to be able to diagnose, to go to the doctor, see whether you have the hepatitis B virus, and then undergo the right treatment. Now, if you look at hepatitis B as a disease, now we have looked at diseases like polio, almost eradicated across the world. You look at smallpox, which has been eradicated. Now, when a disease has to be treated, we have to have a disease which can easily be prevented, a disease which, if it is there, can be picked up easily by simple tests, a disease which, if treated, if diagnosed early, can be easily treated, and whatever medicines are there should not have too many side effects. If you look at hepatitis B, it is one such disease which fits all these criteria. You can avoid it by a simple vaccine. I see no reason why every single one of us should not have the hepatitis B vaccine. It's a wonderfully effective vaccine which is available throughout our country. So, 1, we can prevent the disease by the virus. 2, you don't have a problem, but still you can go and get a very simple test done so that you pick up whether you have hepatitis B or not. So it has got a screening test. 3, if it's diagnosed, then we can easily treat it with tablets which have very little side effects. So if you look at all these factors, you realize that hepatitis B should not be. It should just disappear from the world if we ensure that we are aware about the disease, treat it wherever it's required to be treated, and prevent it in every single case. So I'm sure with more and more awareness, a day will come when we will not have hepatitis B. Till that period, be aware, be careful, be vigilant, and if you have the hepatitis B virus, try and pick it up early, try and get treatment early. Take care.